Hi, my name's Stephanie Russell. I'm a supervisor for Long-Term Supports and Services Medical Determination Unit. I'm going to be discussing environmental accessibility services. Environmental accessibility services, or EAS, are adaptations to a participant's home or vehicle which are necessary to support their health and safety. In order for EAS to be a covered service, a New Hampshire Medicaid enrolled licensed practitioner must determine the need for the services. Case manager would request a prior authorization, and the department needs to approve this, and the service is completed by a provider enrolled with the department. Some examples of EAS that are covered would be the installation of ramps, grab bars, widening of doorways, and electronic aids to daily living, as well as other adaptations that are not covered under the Medicaid state plan. Examples of EAS that would not be covered are general utility improvements, adding square footage to a home unless it's required to complete an adaptation, purchase of a vehicle, and electrical and plumbing work beyond what is required for a specific adaptation. The documents that the department will require for an EAS are a completed 3715 form, an evaluation that describes the medical or functional need, a description including measurements of the adaptation and the training plan for the participant. Some other required documentation would include proposals from 2 EAS providers. If there is only one available, then an explanation of this, a supply list and blueprints or scaled drawings, names of any subcontractors, written confirmation if a building permit is required, and if electrical or plumbing work is being done, then a copy of their license and a signed statement of why this work is required. Other additionally required documents would be signed statements from the EAS provider of building codes and permits required and if subcontractors are licensed. If a participant prefers one bid over another, the case manager should submit this information to the department. And lastly, if the participant is not the homeowner, then a written statement from the property owner is required stating that they grant permission for this EAS. A requirement for EAS providers to be enrolled are they would be licensed to perform the work, registered with the New Hampshire Secretary of State, be insured with general liability insurance for no less than $50,000, and submitted all of this documentation to the department's fiscal agent. If there are any discrepancies between the recommended specifications and the EAS provider's quote, then the case manager should not submit this request until that has been resolved. Once all of the needed documentation has been received by the department, the initial authorization shall be made for 50% of the modification expense. In order to receive the final payment for the EAS, the case manager would need to upload the following documents. We would need a copy of the building permit, written confirmation from the building inspector that the work has been completed, a signed statement from the participant or property owner that the work has been completed, a signed confirmation from the case manager of work being completed, and a signed confirmation from the participant that they have been trained on how to use the new adaptation. Upon completion, if within 90 days there's any discrepancy between the provider's quote and the delivered or installed EAS, then the EAS provider shall replace the equipment or modification. This includes a restocking fee that the EAS provider will incur. The provider may provide a revised quote for the same cost and include a restocking fee for authorization to the department. So what has changed? We've added that an EAS may include modifications to a participant's vehicle. We've included electronic aids to daily living as part of services. We've added an allowance for modifications that add square footage when an addition is necessary for the needed adaptation. We no longer require 2 proposals if the cost is less than $5,000. We've added that a property owner must sign off on approving the work if the participant is not the property owner. We've clarified to the process for revised quotes when equipment or modification needs to be replaced. And we've added that EAS will make an initial authorization for 50% of the expense when proposals and prior authorization is approved, and the final amount will be made once all of the requirements are met and the work has been completed. If you would like further information on the Choices for Independence program, please visit our website at dhhs.nh.gov.